Hi, and welcome to the Healthy Built Environment for Health Professionals training series. We're excited to be introducing John Reilly today from Capital Regional District. And John will be presenting his presentation titled Health and Housing, Creating a Healthy Built Environment. All right, I'll pass the mic off to you, John.
Great, thanks, Kelsey. It's great to be here, and I'm happy to provide a little bit of the presentation here around health and housing. A little bit about myself, just to let you know. I've been with the CRD for a little under a year now. Before that, I was doing mostly housing planning and policy work for the City of Victoria as their senior social planner. And before that, I've got about a 10-year career now in municipal planning work, social planning work. And before that, did a lot of community work and also worked for actually an elected official at the municipal level in Edmonton in my career. So got lots of experience both at the lived community and sort of activist and organizing work in local communities, and then working at a municipal level. So I've seen health and housing issues really from a very broad spectrum over my career. I've been very, very fortunate to have a lot of different experiences. So some of the stuff I'll talk about, though, is going to be pretty much focused here in the region. I want to give you a couple of regional examples, and then also talk about what is working here currently, both at a national level and local level and a provincial level. Talk a little bit about the conflicts and tensions that we see with respect to trying to improve the level of health and well-being in our communities through the delivery of housing programs and the development of housing and the different types of housing, and then talk a little bit about what I think are some areas that we need to be looking at in terms of plotting a way ahead in terms of improving the health and well-being of people in our community through using housing programs. So I want to come back and just talk about the planning principles that under our sort of a foundation of the project here that Island Health is engaged in here. Of course, one of the key principles is increasing access to affordable housing. Of course, affordable housing and affordability is a key determinant of well-being because the more people have to pay for their housing, the less they'll have to pay for other items or services that they're going to need to help ensure their well-being and health in the community. Also looking at the diversity of housing forms and tenures is also really important in terms of providing a variety of options and choice for people. We know that the more choice that people have, certainly the more free they feel, and certainly that also improves people's health. Of course, we want to look at ensuring adequate housing quality. Now, the CRD doesn't have as much role in ensuring adequate quality in that we're not involved in housing inspection work as much. We've got a couple of electoral areas where we do play that role, but mostly that is the municipal government's role. So the District of Saanich, the City of Victoria, the City of Langford tend to pay more attention to ensuring that there's a good quality of housing and actually having services focused on that. In terms of prioritizing housing for the homeless, elderly, and low-income groups, you're going to see some of the work that we're doing here in the region clearly is addressing this principle. And finally, site and zone housing developments to minimize exposure. I think that's something we all work with in terms of the cities themselves, the municipal governments, us as a regional government, to ensure the developments of these houses are not in any areas that are exposed to great danger. And of course, these days we're talking a lot about earthquake dangers and tsunami dangers here in the region. So that's certainly a new one for, I think, a lot of folks when we start talking about housing development to ensure their safety in terms of their exposure to those kinds of hazards. I wanted to start with a couple of case examples that I think really help focus on some of the issues and concerns. There's two different target groups that I'm going to focus on, and please recognize that there are far more target groups that are of concern and of need in our region than just the two I'm going to talk about. I'm going to focus specifically on singles and Aboriginal people, but there's also seniors, there's folks with disabilities, there's folks who struggle with mental health issues, addiction issues, those kinds of challenges. Some of the interventions I'm going to talk about will touch on that, but I'm not going to focus on specific case examples, but just know that those are also priority areas single parents with children are really some of the most hard done by folks in our community in terms of affordability. So we also are concerned about those groups as well. But certainly these two help raise some issues around housing and health. So the first is singles, and singles, of course, coming into the region. We're often talking about young workers who are working in our service industries. At times they're also students. They'll probably play both roles at times, as being students and also working in the service industry. Often their incomes are low and they're not able to achieve the kinds of rents that are available here in Victoria. $750 to $850 for a bachelor unit is going to be very challenging for a service worker or a student to achieve. So what we often see them is, overcrowding, trying to live, quite a few folks living in the same building. Oftentimes this can lead to very unsafe conditions in those buildings. They're really not built to accommodate that many people, and we have real challenges. And in recent years we saw a terribly tragic fire here in Victoria where a number of young people actually died in that fire, and there was evidence that some were visiting that home, but it was an older home that was being used for the purposes of renting out to young people, singles, and students. So, but a few years ago, the Greater Victoria Housing Society came up with an innovative project here in Victoria, and they helped develop the project you see in the picture there, which is called Pembroke Muse. It's down on Pembroke and Government Streets here in Victoria. We got about 25 units of very affordable rents for singles, and it's close to the downtown. It's very close to a busy transit area to get out to most of the post-secondary institutions in the region, and it's very close to employment for the folks who would be working in the service industry. And that project was developed by a nonprofit. It was funded through both investments from BC Housing, the Capital Regional District's Regional Housing Trust Fund, and a local fund from the City of Victoria. They have their own housing fund as well to help provide greater affordability. And the investments that the city and the region make are specifically addressed to try to bring those rents down, to try to make these units more affordable. And I think some of the bachelor suites, for instance, in that project are renting at about $650 a month or even less, which is substantially below. It's about 25 to 26% below market in the region right now. So that's one really good example of providing much more safe and better quality housing for some of our working singles and students in the region. The other case example is a project called Siem Lalem House, which is out at 120 Gorge Road here in Victoria. What we have here is a number of years ago, a lot of the older motels were beginning to move into more disrepair. A lot of them weren't actually being used for transient occupancy anymore. Many of them were occupied by people who were needing very, very low-cost housing. So the owners of those properties were beginning to rent them out more as longer-term housing than they were for hotel or motel use or by tourists. So there was a non-conforming land use issue there. We had, in some cases, a lot of them were becoming very unsafe and unhealthy conditions. They weren't necessarily being operated by the most scrupulous of landlords. So we were seeing increased targeted enforcement in those buildings in order to ensure the health and safety of people living in those properties. And of course, with Aboriginal people, one of the big challenges that they face is there's clearly discrimination in the market. An Aboriginal woman, let's say, with a couple of children, is going to face much higher levels of discrimination. And it can be very insidious and may not be overt. When that young woman, for example, shows up to try to rent a unit, they'll be told by the landlord, oh, sorry, I have already rented it out, when they haven't, because they're concerned or afraid of renting it out to an Aboriginal person. It's really not a fair practice, but it happens out there, and it's disturbing. So we know we need to do a better job of providing options that Aboriginals in our community can actually achieve lower housing costs and be included in projects that are good quality housing. So the Victoria Native Friendship Centre and the City of Victoria got into a partnership, and the CRD is also invested in this project through its Regional Housing Trust Fund to provide good quality units and to redevelop a property and shift it, rezone it from existing transient use to long-term residential use. And they've currently repurposed one of the buildings, and they've completed the demolition of the second building and are going to be building a brand new property there. We're going to have, in the end, 41 new units of very good quality, I would say, and very low cost. We're talking about a one-bedroom in these units are renting out at about $425 a month, which can really help meet the needs of First Nations and Aboriginal people in our community, because their incomes are traditionally very, very low. And it's a really wonderful partnership. In this case, the ownership is actually shifting over to the Victoria Native Friendship Center, and it'll be operated and owned by the nonprofit here in the community. So I want to talk a little bit about, excuse me, the role of the CRD within these projects. As you could see, these projects fit within the project that we have going, which is the Regional Housing Trust Fund, which is a housing investment fund. But the CRD also plays some really important strategic planning roles. The region is now currently moving through the final phases of the update of its regional growth strategy. The growth strategy is designed to look at demographic shifts and changes and land use changes that are needed to help support population changes in the region. Also, where service structures and where we see commercial and industrial development, and plus also natural resource development is a big issue in the regional area, because you can see the very large green area on that map outlines these are natural resource harvesting areas for the forestry industry. Also, our watershed there, the Souk Lake area, is a protected area in order to protect our water supply for the region. Well, two very, very important parts of ensuring the health of any given community is employment, the use of natural resources, and also the protection of water systems. We also have a housing affordability strategy that actually grows out of the regional growth strategy. We have recognized for over a decade now that housing affordability is a significant problem. It's very pernicious, and we're still having a lot of difficulty achieving what we consider to be really good, affordable levels of housing in the region, but we continue to work on it. The housing strategy has existed for about 9 years now, and we're currently reviewing it and going to be updating it. We hope to do a little bit of engagement with local development industry and also our municipal partners and other groups in order to update that housing affordability strategy and see if we can introduce some new approaches that could help address affordability. Some of the case studies that I identified and the Regional Housing Trust Fund itself actually have grown out of that regional housing affordability strategy. They're real tangible results of the work that went into that strategy. The other things that the Capital Region Housing Corporation is a function of the CRD. The CRHC, as we call it, owns and operates over 1,200 units of social housing. Most of this housing is targeted towards either seniors or families with children that tend to be prioritized for those purposes. The CRHC also manages a little over 300 other units of housing on behalf of other nonprofit providers in the community. The CRD also provides a little over $200,000 a year to help the operations of the Greater Victoria Coalition to End Homelessness. Many of you probably who are from Victoria listening to this will recognize the work of the coalition, and of course homelessness is high on the agenda here in the region these days. So really it's really become a significant priority, and I'll talk about that a little bit more about that in a minute. One of the newest and most emerging roles for the region right now is the Regional Housing First initiative. And this is this initiative to try to help address street homelessness and the fact that folks are sheltered outdoors in our parks in both Saanich and Victoria. We also know that there's a real challenge with folks sheltering outdoors in places like Salt Spring Island and Souk. So it's a very, very large region. It has very diverse, different communities. So we've got to be attuned to all those different regional differences when looking at approaches to addressing homelessness. So, and currently we're just getting started in this. The Victoria City Council brought a motion to the CRD to consider borrowing up to $30 million in order to help build more affordable housing that could be specifically targeted to meet the needs of those who are sheltering outdoors. And of course, we all know that folks who are forced to shelter outdoors have terribly negative health impacts on their lives. So we really want to help address that. We also know that a lot of the folks that are sheltering outdoors are either suffering addictions issues, which is a significant health issue, plus are usually also sometimes cross-diagnosed with mental health issues. And we need to be doing a better job to help address those folks' needs because that doesn't only create issues in terms of their individual health, but community health overall. So we're currently we've signed a partnership agreement with Island Health and BC Housing, and we're moving forward. BC Housing has committed an additional $30 million, so we're going to have $60 million to look at building either fixed-based supported housing or supported housing within low-income or low-cost overall rental housing developments throughout the region. And we see that probably rolling out over about the next 5 to 7 years in terms of the development of the actual projects. And then, of course, they'll operate for anywhere between 30 and 50 years in the community. One of the undergirding principles of the project is we want to see these initiatives work together in order to achieve what we call housing first principles, which is about ensuring that there's permanent housing most immediately available that provide the support for folks to be successful in their tenancies and to live a good, healthy life. What we've seen in the past is more trying to move people through a continuum of housing from beginning, let's say, at the shelter state, moving then into some kind of transitional housing or short-term housing, and then maybe potentially moving out to more permanent housing. Well, Housing First kind of we want to turn that on its head a bit and say, no, let's get them into permanent housing and have the supports available so folks that are housed don't necessarily have to move all the time. We know that moving can have a tremendously negative impact on people's health, and really they don't have an opportunity then over, let's say, a period of 3 or 4 years in their lives to really build the kind of social connections and the sense of community belonging that is needed to ensure a good, healthy life in the community. So what's working? Excuse me. Here in Victoria, I would say we're seeing a real step up in government investment in housing and supports to help address some of the challenges related to homelessness and housing affordability in our region. Like I said, BC Housing is coming in with $30 million. The region has committed another $30 million that we're going to borrow and finance in order to help build some new initiatives. The federal government has announced not only increased investment in housing infrastructure, but they're going to double the investment they're making into the homelessness partnering strategy. The CRD actually is the community entity. We were responsible for helping distribute the homelessness partnering strategy funds here in Victoria. So we're going to get double that amount. We're expecting to have to do another call for proposals to see some new projects developed here in the region to help address homelessness, to help provide those support services that we were talking about. We're seeing shifting land use patterns, of course. Many of us will know that many municipalities are looking at ways of using densification, as we call it, to improve housing affordability. But we're also looking at it as a strategic way of addressing concerns related to sprawl and transportation. And these land use patterns means that we're trying to see some additional densification, perhaps in areas that aren't used to the levels of density that they've seen in the past. But these land use patterns really help create an avenue towards greater affordability and certainly a greater diversity of housing. The other key thing that's working is partnerships. None of this work that we're talking about, as you can see with the case examples I provided, we're talking about a very sophisticated partnerships between nonprofit organizations, regional government, the private sector in some cases, and also provincial and federal government. So these partnerships are absolutely essential to the success of our programs. So where do we see some conflict and tensions? Currently, we see some conflict and tensions because of, I would say, 25 years of what I would call stagnant investment from governments around affordable housing. So we've seen actually neighborhoods and communities develop in a very, what I would say, a monocultural pattern on the basis of economics. So, whereas 25 years ago, we would have seen a new neighborhood would have a wide range of different housing in terms of its diversity and affordability, we've seen mostly market-based housing built in those communities. It creates some challenges and opportunities now as we start to want to see some densification or changing in land use in order to address some of the affordability and the diversity of housing needs we have. So we'll get pushback sometimes within communities. They'll be resistant to that change because they're used to living in what we consider to be, single-family homes in a very subdivision-oriented, land use pattern. We're starting to see some challenges as new projects come forward, and we want to see maybe some of the changes that folks that are used to a certain kind of land use pattern are seeing some different approaches, which creates some tension. One of the biggest challenges I think that we've seen, and that's emerging, it's certainly the crash of 2008 and the recession helped us understand one of the biggest conflicts is the changing role of housing in the community overall. Housing is being seen more as an investment now rather than a place of home and community, which is creating some real challenges. Some would argue that the bidding up of property values in Vancouver, for example, is partly really driven by seeing housing more as an investment rather than as a place to be living and making your home. And that's created some challenges. We're seeing, residential properties being turned into more transient property uses through things like Airbnb. So we lose that housing as necessarily helping to provide for local need and see it turning to trying to provide a need that could potentially be more lucrative for the person who owns the housing but doesn't necessarily meet local community need. So we're really seeing some shifts here, and I don't know, my judgment is that we need to start coming to terms with that as a culture, because if we continue to focus on housing as an investment, I think we're going to continue to see some of these affordability challenges increase. We have regional competition, which is a bit of a challenge and a tension here in the capital region. The cities want to see development. Development can bring revenue into their housing, into their tax structure, and then we start to see some competitiveness around, the lowering of fees and then pushing others to do the same, and that can sometimes create tensions between and among the different municipalities here in the region. And there's challenges related to when that competition develops and you get differential approaches to land use or municipal approval processes, then there's frustrations among the developers because they're expecting, how come things aren't the same in Langford as they are in Victoria. So we start to see some tensions and challenges arise there. Those shifting land use patterns I talked about are also can be a source of conflict and tension, as I mentioned, when local residents who are not used to the kinds of developments that are being proposed in the local neighborhood can become resistant just on the basis of the kinds of housing that's being developed. But we also see resistance on the basis of the kinds of tenants or the residents that will be living in that housing. And unfortunately, some of that can become negative, and we can see, as we call not in my backyard, NIMBY approaches that can emerge. And that's a bit of a challenge, and I think we've got to do good work in local communities to help people understand the need that's being met, and also help them understand that how meeting that need not only going to improve their well-being, the residents that are moving in, but it's going to improve the well-being of the whole community in terms of improving standards for everyone. So I want to talk a little bit about collaboration and some of the experiences that I've had in my work. over the years. I've seen collaboration both from really at a very community level and then at a very high level in terms of organizations and large-scale organizations and governments working together to address housing and health issues. First of all, I used to be a neighborhood organizer in Edmonton, and we used to go door to door working with folks who had identified, the misuse of housing, as I call it, for either drug trafficking or conducting illegal prostitution in a local neighborhood, which can have a terribly detrimental effect on a local block or a couple of blocks around that house. So we were organizing with folks to actually get the municipality to be more responsive, the police to be more responsive, and the housing inspectors to be more responsive to these kinds of problems and to use the tools that we had to address criminal activity in the community, which can really undermine the health and well-being of not just the folks living next door to a place like that, but the whole block and the whole community overall. I've also seen collaboration at the municipal level when I was working as a senior social planner. When sheltering in parks began to emerge, we had to move very quickly to bring together police, local nonprofits, the city itself, the region, to begin looking at finding some solutions. Island Health as well, and as we've seen with Tent City now, we've had to see a significant amount of collaboration, and certainly that stepped up. It seemed the pressure in our region to see some solutions come. Some of the solutions that have been introduced are very helpful at relieving some of the immediate pressure. Things like using the former youth detention center as a short-term transitional housing program, which is now called Choices. We saw the city step up using one of its properties, the former Boys and Girls property, Boys and Girls Society property on, I think it's on Yates. That's been turned into a short-term shelter as well. However, these aren't long-term solutions. I think we see the Regional Housing First initiative as being more probably be able to provide us with the long-term solutions that we need, so that we don't see folks, sheltering in our streets and in our parks in the future. We've done a recent point-in-time count of people who are homeless. We've seen tremendous collaboration there between, nonprofit organizations like the Community Social Planning Council. In order to do the point-in-time count, the collaboration went beyond just the nonprofits. We reached out and actually attracted volunteers from all over the city to come in and help out with that count. And it was very interesting the night of the count when we were out there to see some of the folks who'd had no experience with people who were homeless come in and recount some of the stories of the people they'd encountered, and you could tell really clearly that their compassion and their awareness of the real struggles of the folks that are out there on our streets and in our parks was changed, that their hearts were changed by the experience they've had, and were very, very moved by some of the stories that they heard when they were out talking to people. And again, policy development, the Regional Housing Affordability Strategy, as I shared with you, we're working with the development community, the nonprofits, other orders of government, local community organizations are working with us through our Housing Action Team to look at policies and projects that could be successful in the future. So it's always about collaboration, and that's the part of the work that I love the most. I've always, I remember talking with an old high school friend of mine when I was younger, and it was in my late 20s, I think, and she said to me, she said, "John, you've always been that way. You've always wanting to get people together." I thought, well, then I guess I must be in the right place, because that's what I spend most of my time doing, is gathering people together to help find solutions to these problems. And I have to say it's probably the most satisfying part of my work, is to see a collaboration of people working together and finding solutions. So in terms of moving ahead, excuse me, getting over a little cold here. So the way ahead that I see, I think increased public policy and investment around affordable housing is still needed. We're going to be putting a policy framework together to help support the Regional Housing First initiative. The investment, I think, is coming, and it's going to be there to help meet the needs of those folks who are really at high risk in terms of housing in our community. But we also need to see continued and sustained investment in just general affordable housing overall. We know that younger people coming into our communities who are of more moderate incomes, seniors who are seeing shifts in their incomes due to their aging and changes in their income structures, are all going to need access to affordable housing. So we also need to ensure that their needs are met as well. I think we've got great collaboration with our nonprofit sector, and I think in terms of some of the projects that are coming forward, I think we're going to need to increase that collaboration and also do some work around shared learning. Both us at the CRD need to learn some more, and as well as our partners in the community around, like, what is this housing first approach? How do we implement it? So we really need to step up our work in collaborating effectively and efficiently as well, so that that housing needs are met, and we start to see some real wins. For example, and if we can help improve the housing and living conditions of those folks living on the streets, we know that that's going to lead to less visits from those folks to the emergency wards, for instance, and will help us direct those resources more to the needs of other folks that sometimes get missed because of our focus on trying to deal with really complex and crisis-oriented cases. I think we want to look at more opportunities. The private sector is quite interested in working with the for-profit and government sector to see where they can also provide solutions. We haven't seen a lot of that implemented here in Victoria. I think we've seen a lot more in Vancouver, some really effective partnerships between private sector and public sector. And I think we're at the point where we're starting to engage in that discussion at a higher level. And we've got, for instance, the involvement with the Urban Development Institute and the Local Builders Association, starting to look at how can we partner up a little bit more effectively. Education at a community level, I think I spoke about that a little bit earlier, about some of the resistance that we're seeing in communities. I think that's got to be done with not just education, but it's also got to be real collaboration and involvement of local communities. They need to feel like they're involved in the process. And for instance, when a nonprofit wants to redevelop an existing property, the first thing that they do is get out to a local community association. They go out and they knock on the doors of folks that are going to be living next to that property. They want them to feel involved at the very early onset. And I think that's an absolute number one best practice, because we know that folks that live in a community, if things are happening around them and they don't feel involved, that can undermine health and well-being. So the more we can involve people and help them feel like they have a say and that their voice counts, people's health improves. I think we've seen that in research. The other work that we need to do is promote these best practices, like I said, not only within our own circle here at the CRD, but we've also got to promote and support them into the community. And I think our work through the homelessness partnering strategy work and through the Coalition to End Homelessness and our work with the Regional Social Planning Council is helping us identify those kinds of best practices and create tools with which people can access and know the kinds of practices that are going to help achieve better results and better health results in the long run. And I think we can do a better job of that. So that's my 2 cents around housing and health. I think there's probably a lot more out there as well. I mean, I've only touched, I believe, on some of the ways and issues. I mean, I'm sure you yourself probably know of some options and some approaches that haven't been mentioned in this presentation. So this comes from our limited experience, my limited experience here in the CRD. So hopefully you'll be able to post some of your own ideas on some of the websites provided by Island Health and maybe share some of those best practices as well. If you do want to talk to me more about the projects that we're involved in here in the Victoria region, you have my contact information here. I would encourage you to send me an email, give me a call. I'd be happy to talk about the work that we're doing here and the wonderful collaboration and partnerships that we have. So thank you very much, and I'm honored to have been asked to provide this presentation. I really do appreciate the opportunity to share the work that's going on here.